cannot, as a community, be delighted that the World Health Organization has classified obesity as a disease and recommend that the treatment for that disease is GLP-1, and then just because it's Christmas, decide that we're going to come off the medication.
This shows a fundamental lack of understanding of what good chronic disease management actually looks like. Let me explain why. Let's take a random chronic disease, say inflammatory bowel. If you go to an inflammatory bowel clinic and you say to the doctor, I've got a holiday coming up, or it's Christmas, it means a lot to me, or it's a big birthday, the doctor won't say, well, we have a treatment plan, this is a rigid treatment plan, you're just going to have to miss out on all these things to stick to the plan. That's rubbish care. What they'll say is this is a long-term chronic condition. We need to fit the treatment around your life. We need to make it work for you. It's about optimizing your quality of life on long-term goals, not quick wins. That's what chronic disease management is about, making it sustainable for the long term. And so actually when you look at it through this lens of what actually chronic disease management means, she's saying the complete opposite and completely misunderstanding it in this video. And this might seem trivial, but so many videos are like this on this platform because people don't know what they're talking about. And that is really worrying. When it comes to what should you do with your GLP-1 over Christmas, actually staying on your GLP-1, like she says, can be a really great thing for so many reasons, but not for the reason she says. And yes, the reason is important because when you're doing chronic disease management, patient education is a huge part of that because you want the patient to become an expert in their own condition and understand it and be able to advocate for themselves on the basis of logic and fact, not on the basis of ridiculous buzzwords. So, for example, over Christmas, you might experience Christmas differently if you stay on the medication. You might find that you don't focus on the food the same. You can enjoy other aspects. And this is an exciting and compelling reason to stay on the medication. But for some people, this might not be the same advice, depending on their background health issues, how they respond to the medication, their plans over Christmas. And being able to modify your treatment plan based on your experience and qualification and understanding is very important. And this is the nuance that a lot of people don't have because they don't have those things. So there are some patients, there's quite a few patients actually that I'm doing things slightly differently for, or I've given advice to do different things over Christmas to try and mitigate the risk of certain things. But being able to work with individuals, not just give generic advice, and understand why you're saying what you're saying is very important in